So in this lecture, we'll discuss consciousness. So let's start with consciousness. Consciousness is our feelings, thoughts, and aroused states, or different states of energy, if you will. And usually we are somewhat aware of these. And sleep is actually one of those states of consciousness. Now, sleep developed over time to possibly accommodate our need to remain in our living spaces or our houses during nighttime, because we can't really see that well at night, so it creates a lot of dangers for us. And we all go through what we call microsleep. It's this brief episode of sleep for about 3 to 15 seconds that occurs when we're awake, and we're usually not aware of this. So even though we can see why sleep might have developed to help keep us safe, we still have all of these answers left unknown as to why do we even sleep. Part of it could be restoration of body tissue and facilitation of body growth. So sleep's connected to our body's metabolic and hormonal processes, so it activates your growth hormone to assist with growth during infancy and through adolescence. And not enough sleep can increase your risk for diabetes, weight gain, and cardiovascular disease. It also helps increase your immunity, so immune cell production increase, and that's usually why we need more sleep when we're sick. It helps keep your mind alert. Your body will become more sensitive to norepinephrine, which assists in alertness throughout the day, and research suggests that sleeps remove amyloid beta metabolites in the brain, which are linked to the development of Alzheimer's disease. You also get enhanced mood. So chemicals influencing mood are activated, and basically poor sleep makes it difficult to regulate emotions and accurately perceive other people's emotions. So sometimes you might misread a person or a situation. And it helps with better memory processing. So what's processed throughout the day is better consolidated and stored during sleep. And the phrase sleep on it is actually a thing. Important details throughout the day are processed further in your sleep, which can create an aha moment the next day. If you've ever had a question or a problem you've been trying to figure out and you can't quite get the answer, but then you wake up the next day and you already have the answer, or it's right there when you wake up, that's the reason why. But how much sleep do we actually need? It depends on a few things: age, lifestyle or your environment, and genetics. So with age, the amount of sleep needed actually decreases. Babies usually need about 12 to 15 hours per day. Preschoolers are around 10 to 13 hours. Teenagers and young adults require 8 to 10 hours per night. And then adults need about 8 hours a night. Your lifestyle or environment also plays a role, so cultural beliefs, lifestyle habits, your bedroom environments, and so forth impact your sleep. An example of this is scrolling on social media while lying in bed. It will actually negatively impact your sleep. A way this occurs is that the blue light emitted can suppress melatonin being secreted, and your mind and body begin to associate the bed with other activities outside of sleep, which can create a negative conditioned response for you to be awake once you get into bed. Another example could be you work at a restaurant maybe until 12 p.m. midnight and you don't go to bed until early morning hours. Then you adopt a different sleep schedule than someone who goes to bed around, let's say, 9 p.m. at night. And then with genetics, again, that plays a role in how much sleep is required, and it can actually influence if you're the night owl or morning person. So a large part of what controls your sleep and wake cycle is your circadian rhythm. It's this built-in 24 to 25 hour cycle we operate on and repeatedly occurs. So it does things like regulating body temperature, alertness, hormone production, and so forth. In the 1930s, a man named Nathaniel Kleitman, he was a physiology professor, and his graduate student Bruce Richardson spent over 32 days in a cave without any exposure to light, and they found they adapted a circadian rhythm about 28 hours, which means their circadian rhythm just repeated every 28 hours. Michel Siffre spent about 2 months in a cave without any references of passing time in 1962 and found his body had a natural circadian rhythm. He then conducted another study in the 70s, and he stayed in the cave for about 6 months and found the same results. Now, what controls the circadian rhythm is the suprachiasmatic nucleus, or the SCN. If you have brain damage in this area, you most likely will struggle with sleep. Concussions can sometimes impact this area, causing the sleep difficulties you commonly see with it. The hypothalamus is also really important because it signals to other areas of the brain when to be awake or aroused and when to sleep and shut down. The hypothalamus also plays that role in hormonal regulation. So if your hormones are imbalanced, then your sleep will be impacted. A lot of women actually during menstrual cycles and even menopause will sometimes struggle with sleep because their cycle causes fluctuating hormonal patterns. We also are very sensitive to light, which affects how it triggers the release of melatonin, that hormone in the body that helps regulate sleep. It is called the Dracula hormone because it comes out at night, and melatonin actually is not the only thing that puts you to sleep. It's actually like an announcer at a race getting all the participants lined up, ensuring the race starts and everyone participating as needed, and then announcing when the race ends. Now, there can be some changes in your circadian rhythm. Typically, it can be interrupted by your weekend sleep schedule, jet lag, and changing work shifts or working night shifts. So usually 1 hour time change typically requires 1 day to reset your circadian rhythm. So sleep has many stages. Typically, they're divided into what we call REM and non-REM. So REM is rapid eye movement, and that's an active state of sleep in which your eyes move. And then non-REM, or non-rapid eye movement, is the relaxing stage of sleep in which the eyes do not move. You typically experience 4 to 5 cycles of REM and non-REM sleep in a given night, and as your sleep progresses, you'll actually spend more time in REM, that rapid eye movement stage, and less time in the deeper non-rapid eye movement stage. So non-REM or non-rapid eye movement has 4 stages. Stage 1 is what we call light sleep. It's characterized by theta waves, and if you look at the picture in the left-hand corner, you can see what theta waves look like. In this stage, you can be easily awakened, and your breathing and heart rate will start to slow. By stage 2, the appearance of what we call sleep spindles. They're a pattern of slower theta wave disrupted by bursts of electrical activity, and they also help with processing learned motor processes start to appear. This will last about 20 minutes, and during this time, your breathing, muscle tension, heart rate, and body temperature will continue to decrease. By stage 3 and 4, you're in what we call slow wave sleep. So stage 3 includes delta brainwave patterns, which again you can see in that picture in the left-hand corner. And consistent patterns of delta waves start indicating you're in stage 4 or deep sleep. Your body's really relaxed during this time. If you're growing, the growth hormone's secreted, and it's usually difficult to wake up from this stage. This is typically where maintenance and restoration of different bodily functions occur, and it lasts about an hour and then shortens as your sleep cycle progresses. So what about REM sleep, or rapid eye movement sleep? Well, that's that active stage where your heart rate, breathing, and blood flow will actually start to increase, but your muscles are essentially paralyzed, so you don't act out your dreams in real time. And REM is very highly connected to dreaming, and you can have what we call paradoxical sleep. So the brain waves during REM and wakefulness look very similar to each other. Now, research is still seeking out the impact of REM sleep, but they speculate it assists with memory storage, processing emotional experiences, and mental strategies such as concentration. Of course, though, with REM sleep, not everyone has that muscle paralysis, and that can be what we call REM behavior disorder. So that might be a condition in which the normal muscle paralysis doesn't occur and can cause violent movements during REM sleep. Sometimes you actually see that with people who have PTSD. And there's also REM rebound. So the loss of REM sleep is recouped by spending more time in REM on subsequent nights to catch up, so to speak, on sleep. And of course, we all have what we know of sleepwalking, where sometimes you see someone sleeping and they're walking in their dreams. To help make further sense of sleep, a lot of people have proposed different theories of dreaming. Freud is one of them. He says that dreams have manifest and latent content. Manifest content is what we recall when we awake, where latent content is the symbolic meaning of a dream. And he says dreams are symbolic and represent unconscious desires, so they allow expressions of fear and sexual and aggressive desires to occur without censorship of your conscious thought. So an example is maybe you have dreams about losing teeth, and that's typically associated with high levels of stress related to loss of control and life changes. There's also the continuity hypothesis, which dreams help us deal with problems and issues of life, and they're not really symbolic. So we dream about our daily experiences and concerns to process, cope, and resolve them. Memory theory states dreams are a function of memory, and all they really do is help you consolidate memories from when you're awake. Threat stimulation theory, or TST, basically says dreams are a biological defense mechanism where we get to practice or rehearse our responses to dangerous situations in an environment that is risk-free. And there's activation synthesis model. So dreams are a byproduct of your electrical signals in your brain occurring during REM sleep. And your cortex creates meaning by synthesizing everything into images and stories based on your already stored memory. So sleep can actually have a lot of disorders, and a sleep disorder is really just any disturbance in the normal pattern of sleeping. A common one we hear about is insomnia. That's usually the inability to get to sleep and or stay asleep. And it can happen for a whole variety of reasons. So maybe stress, grief and loss, changes in your sleep schedule, mental health concerns, drug abuse, chronic pain, obesity, even concussions, and so much more can cause it. You also have narcolepsy, so that's when people randomly fall asleep during alert times of the day. There's sleep apnea, where your breathing will stop while sleeping and you'll snore to try and obtain air. Restless leg syndrome, or RLS, where it's a sensation in the legs and this irresistible urge to move them to relieve any sort of discomfort that it's causing. There's also sleepwalking, occurring during that non-REM slow wave sleep where people get up and walk around and sometimes perform actions. There are night terrors, so you're waking up in an apparent state of fear. Usually this is different from nightmares. Nightmares are just scary dreams. And there's enuresis, which is bedwetting in children at least 5 years old. And that will occur about 2 times a week for a few months. Because insomnia is so prevalent and common, we'll just go over briefly how it's typically treated. It's usually first and foremost treated with medication, so like Xanax, Ambien, or even over-the-counter antihistamines and pain relievers that can help induce drowsiness. The only thing is you want to use meds for the short term because long-term use can lead to dependency or even addiction, and side effects of memory loss, fatigue, and increase in sleepiness can occur. So if you're trying to overcome insomnia, obviously not every recommendation works for everyone, but usually what will happen is people try to encourage you to establish a very consistent regular sleep-wake cycle, avoiding naps or only taking 15 to 20-minute naps, not using your bed for anything other than sleeping, so no scrolling through social media or watching shows and movies in bed. If you can't get to sleep after 15 minutes, maybe get up and do something that might induce some sleepiness. Also avoid sleeping pills, alcohol, nicotine, and caffeine. Exercising during the day can help promote sleep at night. And like we said, turning off cell phones, tablets, video games, computers, and lights. Anything that's really emitting that blue light that can help increase your chance to produce melatonin. We also have some gender, ethnicity, and cultural differences when it comes to sleep. Some examples are that women are more likely to require 8 hours of sleep than men, or African American sleep is worse than European Americans, or snoring and sleep apnea are more common in men. You can read the list for more, but a lot of times the cultural differences typically tend to indicate contextual differences. So everyone holds a very different experience in this world, so many variances within our sleep could be attributed to those differences. Now, I'm sure you've heard of hypnosis, meditation, and mindfulness. They're not just associated with therapy, they also can be recommended for sleep. Hypnosis is the state of relaxation where you are more impacted by a person's suggestions. So you're not actually just being told what to do and following orders. You're just so relaxed. You're just more open to whatever someone suggests. And so what will happen is you'll focus on an object, image, or the voice of a person. And subjects or people will remain in control of their bodies the whole time, and you're aware of your surroundings. Meditation is where a person will focus their attention on a singular source for a period of time. So maybe you're focusing your attention on a sound or an object or some open distance space. And then mindfulness meditation is this intentional focus and attention to what's going on in the present moment without judgment. So maybe you're looking at thoughts, emotions, or sensations, but you're not really focusing and thinking too much about them. You're just kind of noticing it and letting it go. And these are things that can help put you in very relaxed states and quiet and calm your mind. So it's easier to fall asleep, and the hope is to stay asleep. So looking a little further into hypnosis, we'll first start with hypnotic susceptibility. So that's your ability to become hypnotized. This differs from person to person. Some people are easily hypnotized, but others are not. And usually those who are easily hypnotized tend to maybe have better focus with their attention, more vivid imaginations, or they might have positive expectations of hypnosis in itself. A theory of hypnosis is neo-dissociation. So this is where we have an altered state of consciousness, and your brain will divide into two parts, or it will dissociate. One is the hypnotic state where the consciousness is voluntarily agreeing to behave according to the hypnotist. And the other one is a hidden observer where you're aware of all that is happening. Another way to think of this is that we actually all dissociate at time or to split or break apart. A common example is when we drive. Maybe you have driven to a location, you got there, but you don't really have this full recollection of every red light you stopped at or every green light you went through. That is a common way we dissociate. There's also response set theory. So hypnosis is a willingness to respond appropriately to those suggestions. This is not an altered state of consciousness at all, but you're more so being influenced by your intentions and your expectations of the hypnosis. Now, there's a lot of common misconceptions with hypnosis. Hypnosis does not exist as a miracle cure for certain habits or addictions. It can definitely be used to treat them, but it has not proven to be more effective than other treatments. It also can't give you certain abilities, but it can help you visualize what optimal performance looks like while lowering self-doubt. So maybe it can also help you visualize what improved sleep looks like. And it doesn't cause age regression, which is reliving childhood experiences and behaving like you did as a child. Usually what happens is people will just act like how they expect children to behave when hypnotized. So you're really not acting as your true childhood self. What it can do, though, is maybe change your experience of physical pain so it's more bearable, but it's not necessarily reducing your sensation of pain. It can also help you relax, decrease stress, and have greater progress in your therapy. And it can also help you maybe recall some forgotten memories. But it is important to note, sometimes memories you recall can be untrue. So the whole past life regression analysis might not always hold some merit. So with mindfulness and meditation, again, you're just focusing your attention on the present without any sort of judgment being attached to it, or at least you're trying to. And in that way, you're trying to alter your state of consciousness. So maybe you can be more relaxed for sleep, or you can just be more relaxed and stress-free in general because you're not trying to hold all the anxieties or worries or fears or concerns. It's more just, I'm noticing something and moving on. And it can have a lot of benefits on health, stress reduction, improving your mood, and like we said, helping with your anxiety and depression. A lot of times you'll hear mindfulness and meditation being used in different breathing exercises, different types of body scans where you go through and notice different sensations in your body, or guided imagery. Someone's painting a picture for you to imagine and follow along with in your mind. But studies should be viewed with caution because they involve a small number of participants and they're not always randomized. So, not everyone has that equal chance of participating or being assigned to different groups randomly. And some studies only look at one form of meditation and will actually generalize the results to others. Now, there are other ways to alter your state of consciousness, and that can be commonly done with psychoactive drugs. These are substances that influence the brain and your behavior. Common ones are actually alcohol, caffeine, marijuana, and nicotine. Marijuana is the most commonly abused drug, and intentional abuse of prescription drugs is actually the second most common type of drug abuse. So like with any drug, you can build a tolerance and potential substance use disorder. So tolerance is the amount of drug needed or required to produce its typical effect. So after using a drug so frequently or so often, a lot of times you'll actually need more and more of it to produce the same effects. There's also what we call a margin of safety. So that's the difference between a safe and a harmful dose of a substance. And a lot of times that margin will start to narrow as your intolerance increases because you're having to take so much more to obtain that same effect. Now, the margin of safety is one of many reasons why you see people accidentally overdosing. And then substance use disorder is your inability to control your drug use despite having negative social, occupational, and health consequences. It typically is seen with a buildup of tolerance, and if you cease use of those drugs, you'll get what we call withdrawal, which is a physical and behavioral impact that occurs after ceasing use. Withdrawal symptoms can vary from drug to drug, but in general, they can include vomiting, physical pain, hallucinations, headaches, emotional distress, and so much more. Now, like I said, not all drugs produce the same withdrawal symptoms, and when withdrawal is experienced, many people will continue drug use to stave off the withdrawal symptoms and that emotional distress that comes with it. Stress, trauma, and genetics do play a role in developing substance use disorder, and the presence of certain environmental stimuli, such as certain things used to take drugs or being in a place you commonly take drugs, can actually trigger your cravings because you've been conditioned to associate drug use with those things. Also, with withdrawal, there's different types. There's acute withdrawal, and that's the primary physical withdrawal symptoms you'll have, and that'll last for about 2 weeks. This usually occurs during what we call detox. And a lot of times you need to be monitored during this time to make sure nothing too terrible happens. There's also what we call PAWS, post-acute withdrawal syndrome, and that's the second stage of withdrawal, and that's where most psychological and emotional symptoms will occur, and that one can actually last for about 1 to 2 years. So that's why a lot of people with substance use disorder need continuing monitoring and therapy and assistance to ensure they're able to get through those psychological and emotional symptoms. So another classification of drugs are depressants. They are substances that will inhibit or slow down normal neural functioning. So this includes alcohol, barbiturates, and sedatives. It is important to note you can die from depressant drug withdrawal because it can cause seizures and comas. So with alcohol, this is the most widely used depressant, and what it'll do is it impacts your GABA neurotransmitter, which is related to anxiety. So you might notice people have maybe a little more of a relaxed, positive mood. It will also depress the cerebral cortex's functioning and inhibit brainstem functioning. So, with that, you'll notice your motor skills are slowed, or maybe people are more impulsive in a really negative way. And with alcohol, you can have binge drinking, which is drinking a large amount in a very short period of time. You have Korsakoff syndrome, so that's a vitamin B deficiency after chronic alcohol abuse, and you're unable to reverse that, and it'll cause memory problems. And you have fetal alcohol syndrome, so that's issues in a developing fetus that happens because you're drinking while pregnant. So you could have a low birth weight, deformities, and brain development difficulties. Now, with barbiturates and sedatives, they're similar to alcohol. They impact GABA, but they also suppress areas of the brain that control breathing and heart rate. So barbiturates are called quote unquote downers, and they're typically medications that reduce anxiety and induce sleep, where sedatives are these tranquilizers. They're typically used to, again, reduce anxiety, and that includes benzodiazepines like Valium and Xanax. So here we have some typical effects of blood alcohol concentration, which is basically the amount of alcohol in your blood. So how alcohol affects everyone is very different depending upon genetics, sex, how empty or full your stomach is, environmental factors, sometimes even culture. Studies show a strong link between alcohol and genetics, and studies also show you can learn to abuse alcohol, such as drinking to avoid stress and conflict, because that is maybe what you saw your parents do. And this slide is just a continuation of those blood alcohol concentration effects. So, alcohol use can have negative social impacts on individuals. It can cause a lot of car accidents or traffic deaths. Specifically, 29% of those are alcohol related in the United States. Usually you'll see impaired driving or driving under the influence, most commonly between ages 16 and 25, but obviously it can occur really at any age older than that. It can also lead to sexual assaults. There's a strong correlation between intimate partner violence and alcohol. And commonly, children who have parents who abuse alcohol are usually more likely to experience higher levels of conflict, physical, emotional, and even sexual abuse. The next classification of substances or drugs are opiates or narcotics. They're your pain-killing drugs like morphine, codeine, heroin, fentanyl, opium, and Vicodin. And one thing with fentanyl is it's extremely dangerous. It's 50 times more powerful than heroin, and it's usually added to drugs to help increase potency and reduce cost. But it obviously can lead to an overdose pretty easily because of how strong it is. And a lot of times, if you buy legal drugs, you don't know if it has fentanyl in it or not. And so what will happen with opiates is they'll mimic your body's natural production of endorphins. And that's really addictive because it'll increase this tense rush of pleasure by exciting other areas of the brain. And your dependency on it can actually develop within a few weeks. So it's really, really quick. Now, the withdrawal symptoms are not life-threatening, but they are brutal. You'll get hot and cold flashes, cramps, sweating, shaking, nausea, vomiting. But the risk of overdose is very life-threatening because of how addictive these drugs can be. Now, a common thing you'll hear about is methadone. That's a buprenorphine, which helps reduce withdrawal symptoms when people are going off of heroin. It won't produce as intense of a high, and it has been found to be effective in treating heroin dependence. And you also have naloxone or Narcan. It's this nasal spray that will reverse the effects of an opioid overdose and restore normal breathing. The only thing is the person has to be monitored because they may require a few doses, because what it'll do is it'll help restore normal breathing, but then maybe the effects of the drug start to kick in again because the drugs aren't out of your system. So you have to be really careful. It's not just one dose administered and then you're done. You can actually buy this at your local pharmacy now or a store. And there is something called neonatal abstinence syndrome. So that's an opioid withdrawal that a baby goes through if their parent or mother was using opiates while you were being born or throughout pregnancy. The next substance we have is stimulants. They are substances that will speed up your normal brain functioning. So things like caffeine, nicotine, cocaine, amphetamines, and MDMA or ecstasy and Molly. The common one is caffeine. That blocks adenosine, these neurochemicals in your brain that lead to sleepiness. And usually what happens is that crash you feel after you drink caffeine is usually because that adenosine is building up over time, because the caffeine will bind to those receptors for adenosine and make you awake and alert. And once those receptors are free, all that adenosine that built up throughout the day will rush towards those receptors and cause that crash. Of course, caffeine can lead to dependence. So if you're not drinking caffeine, you might get headaches, irritability, tiredness, or even flu-like symptoms. And too much caffeine can increase your risk of blood pressure, and it can also cause fibroid cysts in women's breasts, and sometimes it can increase your risk of miscarriage, or some people just feel very wired and anxious at times. You also have nicotine. So that will impact your neurotransmitter acetylcholine and glutamate, which helps with attention. So people usually say nicotine can help them focus. That's why. It'll also elevate dopamine, so it can lead to pleasure and reward. And a lot of times you'll get your nicotine from things like vape pens, cigarettes, cigars, chew. Tobacco use is associated with quite many health risks, actually, such as stroke, heart disease, chronic obstructive pulmonary disease, or COPD. And there are some effects of vape smoke on infants and children that's being looked into. One of them is called third-hand smoke. So that's the residue of tobacco smoke or vape smoke that's still on clothes, furnitures, and walls, and how that is impacting people. Part of the stimulant family is crack and cocaine. So cocaine's derivative is crack. Cocaine blocks the dopamine transporter, which helps the reuptake or recycling of dopamine into the neuron. So what it'll do is it actually increases the amount of dopamine just hanging out there that's available in that synapse because it's not binding to any receptors. So dopamine buildup produces an instant surge of arousal, pleasure, and optimism. Your appetite decreases, heart rate, blood pressure, and alertness will increase. When cocaine wears off, you'll obviously crash and show very low energy and very depressed mood. And if you have too much, you can become paranoid, have issues with sleep, delusions, seizures, stroke, possibly cardiac arrest. And the reason this is so addictive is because it's so quickly absorbed into the body. So another part of the stimulant family are amphetamines. So amphetamines are basically what we call uppers or speed. They're very similar to the effects of cocaine. They just don't produce such an intense high, and the impact is usually longer, so they'll last for a few hours. Now, part of amphetamine can be methamphetamine. That's what affects dopamine, serotonin, and norepinephrine levels in the brain. It'll block dopamine reuptake, or that recycling of dopamine, and increase the release of dopamine. So you have a lot more dopamine being available in that synapse to bind to those receptors. It can lead to a crash, though, where you have low energy, paranoia, and depressed mood, and it remains present in the brain, again, much longer than cocaine. A lot of times, the most common amphetamines you'll hear about are usually stimulants to treat ADHD, like Adderall, Vyvanse, or Concerta. And that's because of how this methamphetamine interacts with the brain. ADHD usually has lower levels of norepinephrine, dopamine, and even sometimes serotonin, which, as you see, it helps increase those. The last drug in the stimulant family we'll look at is MDMA, or ecstasy/Molly. The pill form is ecstasy, and Molly is usually a pure form, supposedly, which is like a powder or crystal. It's originally an anti-bleeding medication and was used to enhance psychotherapy and couples counseling way back when. Of course, now it's illegal. So what it does is it increases free serotonin in the brain and heightens your mood and energy, and creating a feeling of warmth, love, and emotional openness, which You could see why maybe it was helpful in couples counseling. Negative effects of it usually include insomnia, teeth clenching, nausea, increased heart rate and blood pressure, fatigue, blurred vision, and people can become very paranoid and depressed and overheat and have cardiac problems, kidney failure, seizures, and stroke while using it. Research on using MDMA for PTSD is actually going on and has been ongoing, and small doses are showing to be positive for treatment of this, but it does require more testing and replication of studies. So another class of drugs we have are hallucinogens. So they're drugs that will at the same time excite and inhibit parts of your nervous system to cause disturbances in your perceptions. One of the most common hallucinogens is marijuana or cannabis. It's very mild and it's been decriminalized and even legalized in certain states, but a lot of times medical marijuana is the most common one we hear about, and it's recommended usually for medical conditions because of those medicinal effects it can have, such as reducing pain or helping with pain and nausea from chemotherapy or anxiety, muscle spasms, multiple sclerosis, and even glaucoma. Part of cannabis, though, or marijuana, is THC, tetrahydrocannabinol. That is this compound that will bind to your neurotransmitter anandamide, and that's what influences learning, short-term memory, motor coordination, emotions, and appetite. So that's why if you use marijuana, those things are usually impacted. You also have CBD, cannabidiol, which helps with relaxation, pain relief, and anti-inflammatory properties. That's usually the really medicinal part of marijuana that people are using. The only thing, though, is marijuana can induce psychosis, which is losing touch with reality, and that leads to hallucinations and delusions. So hallucinations are when you're experiencing things with your senses that are not real, while delusions are false beliefs. Actually, all hallucinogens can cause psychosis, but I bring it up with marijuana because it's a common misconception that it cannot cause psychosis when it absolutely can. And one of the ways you increase your risk for that is if you are taking marijuana with other medications that are prescribed or even illegal. I actually had a client who was taking a certain mood disorder medication for depression, and what happened was it induced psychosis and they were starting to see shadow figures. So we had to get that managed because it was causing them quite a many problems. Another hallucinogen is phencyclidine or PCP. And this originally was an anesthetic for surgery because it inhibited glutamate, which is involved in the perception of pain. So it actually reduced pain that you felt, and it inhibited your response to your memory and environment. But it is a hallucinogenic, and it also can cause stimulant and depressant effects. So a lot of times you'll see people use this separately or pair it with other drugs to enhance all the other effects it might be causing. Long-term use, though, does create issues with your fine motor skills like writing, memory loss, and difficulty speaking and thinking. And the other hallucinogen is lysergic acid dithylamide, which is LSD. So that will increase your blood pressure, heart rate, dizziness. You might lose your appetite or have nausea. But the most well-known symptoms are the hallucinations and distortions you get in your senses. So you might get what we call synesthesia. So you're hearing and feeling colors and sounds, or you might imagine dinosaurs walking in front of you. Your tolerance can develop to this, and persistent psychosis and hallucinogen persisting perception disorder is a thing with this. It's a mouthful, but what it basically means is a psychotic-like state after a trip has ended can actually cause mood swings, more hallucinations, and more visual disturbances, and it will last for a few hours, weeks, or sometimes even years. So you have to be very careful with how much you take. Canada is actually doing a lot of research on using LSD for treating mental health disorders, and right now it looks very promising, but they're still doing more to make sure it's safe. And that concludes our lecture on consciousness.